Welcome back to The Secret Files, a podcast series sponsored by Cutera. In the first two installments of this three-part series, we heard from experts who introduced us to the secret RF fractional radio frequency, or RF microneedling system.
This is an exciting technology because the energy gets delivered right where it's needed, which is underneath the skin. So in a safe way and a controlled way, it delivers heat energy, it causes a change to the collagen that allows it to remodel and thereby tighten the skin.
Cutera gathered a panel of experts to discuss the technology and its use. In the last edition, they discussed why they turned to secret RF in their aesthetic practices. Co-moderator Dr. Ashish Bhatia addressed the versatility of the system.
So we've had an opportunity to play with a lot of different devices, and one of the things that I really liked about the secret RF was its versatility. It really gives you kind of all of the options. There's a large tip and a small tip, 64 pin and the 25 pin tip, and so typically we use the larger tip on the body so we can cover larger areas quickly. The 25 pin lets me kind of get into very delicate areas very easily, such as near the eyelids and around the nose and that type of thing.
Dr. Bhatia is an associate professor of clinical dermatology at Northwestern University in Chicago and is also in private practice at Oak Dermatology. He was joined by his professional partner and co-moderator, Dr. Jeff Su. Dr. Su is the co-founder of Oak Dermatology with Dr. Bhatia. He is also a clinical assistant professor at the University of Illinois, Chicago. Dr. Su posed a question to Dr. Douglas Fife about the management of patients treated with secret RF.
Doug, what do you do about post-care? I know Adriana kind of mentioned her protocol.
We do not have as robust of a post-care treatment as some of the other experts on the panel.
Dr. Fife is co-founder of Avita Dermatology in Las Vegas and associate faculty in the Department of Plastic Surgery at the University of Nevada.
What I will say on the pain control is that we have Pronox in our practice, and it helps in certain circumstances. We've used it a few times on our secret RF patients, but we found that we don't really need it. If we do our passes on the same location, one right after the other, and then move to the next area that we wipe off the topical, we haven't really needed Pronox. When we first used it, we did do Pronox on a few patients.
Dr. Adriana Holly weighed in to seek clarification. She is the owner and medical director of the Center for Advanced Dermatology in Phoenix, Arizona.
So what you do then, Doug, is that you will treat an area and then you remove the numbing medicine for the next area. So you're just going area by area?
Correct. Yes. If we're doing a whole face treatment, we would do one large area like forehead or one side of the face and just do our 2 or 3 passes in that area and then wipe it off of the other area. And we find that the patient tolerance is better when we do it that way.
Interesting. One thing I found to be helpful is in between passes, right after one pass, I will actually just go ahead and sprinkle lidocaine on the surface and just rub it in. And do the other area, and then before let the lidocaine soak in a little bit and come back and do a second pass. I found that to be helpful as well.
Oh, that's a nice idea too.
Knowing how his colleague approaches post-care, Dr. Su asked Dr. Bhatia to share his protocol with the group.
For post-care, one of the things that we found is really helpful to help the patient with it for a quick recovery is actually elastin. So we use their skin nectar. And this has quite a few different ingredients in it, but most of them help with the remodeling and renewal of the substance of the skin. And also, there's something in there that also helps with any bruising or erythema that could occur after treatments. And so I feel like patients, they really like applying it because it's quite soothing, but B, it really calms the erythema down very quickly, and patients recover very quickly from the treatments, and that helps them just get on with their life. But more on the microscopic level, I feel like it really does a good job of renewal and helping the skin improve and bounce back quickly.
Just like Ashish, I'm a big fan of Elasto Nectar, which, like you mentioned, has proprietary technology to enhance the neocollagenesis process. I'm asking my patients to apply that 2 or 3 times a day for up to a couple of weeks just to maximize its effect. But I think the point is that because the secret RF, there's very little epidermal disruption, thermal disruption of the epidermis, so we can get away from using heavy duty ointments that we used to. So we have the freedom now to use something lighter, something that don't lead to inflammatory acne and other sequela. So it's really been very nice to have that freedom to use some of these additional products to enhance the collagen generation process.
As you mentioned, it doesn't result in acne because it's not comedogenic. So it's really nice to be able to give them something like that. I also use that as pre-care for my patients as well. So I'll have them use it for a few weeks prior to treatments as well, and it kind of preps them and gets their skin prepped for this nice aggressive treatment that will help renew their skin. One of the questions I wanted to throw out there to the experts is when do you guys change the RF duration or the pulse duration? How do you use that when you're customizing your treatments?
Adriana also mentioned this as well. Part of it is the patient discomfort. So if we can take that out of the equation, I like to give the patient as a aggressive treatment as I possibly can to get their bang for the buck. So for eyelids, for example, once I'm able to mesh the entire area with dilute lidocaine with micro cannula, then I'm actually extending the pulse duration by quite a bit. For example, at 3 passes, 1.3, 1.0, 0.8 millimeters, respectively, I'm going 200 milliseconds, 150, and 100. So that's a little longer than the previous described protocol. But I'm thinking that that's the kind of settings that we need to get the results that we want.
That's great. Yeah, one of the things I like to do is in areas where there's a lot of telangiectasias and they might be prone to bruising. I like to use, like you said, a higher energy, but then also a longer pulse duration as well, because it tends to seal off these micro vessels that you get into and leads to a less chance of any bruising. So, especially the patients that have a lot of little fine vessels all around the eyelid, I find this is a really nice area to do this with.
In their experience using Secret RF, what are the panelists happiest about? Have they been surprised? That's the question Dr. Bhatia posed to the panel.
I've been most surprised by how much patients like this treatment. So I'm finding that they want to come back again and do a second treatment, that they notice results. They love the downtime, but even more, they love the effect that it's having on the skin. And the majority of patients have come back saying that they notice that the skin is tighter, that the lines are reduced.
Fantastic. And Adriana, what have you been most surprised or happy with since you've integrated Secret RF into your practice?
Well, I love the fact that there is minimal downtime. This is such an advance in dermatology. I can't even say enough about it. I explain to the patients that by tightening the skin, they're actually going to decrease their needs for fillers and other aesthetic procedures, and they love that. And like everyone has commented on, the ability to efface those lines around the eyes and around the mouths is spectacular. The other thing that I was very surprised about was really how much people care about the arms. And so we've been doing a lot of treatments, always with a large tip, going the full circumference of the arm. And the patients are thrilled with that, and actually also the knees and the thighs. So that I think is a relatively untapped market. So this is a great device for that. The patients are thrilled. So that was a big surprise for me.
That's fantastic. Could you tell us just a little bit more about your treatment of the knees? I mean, that's such a tough area. And, we've tried so many things in that area and patients complain about it, especially, the thinner patients that have a little bit of photo damage, above the knee, they just can't stand that crepey skin, loose skin there. Tell us a little bit about how you deal with that.
Yes, well, we do try to push the settings. We're using 60% with the large tip, which is, I think it's pretty hot. Maybe we could even go to 70. But again, it might be a discomfort problem. We treat with a 50-50 overlap and probably around 150 is milliseconds. And, it is important to treat the full circumference of the thigh. As we know from facial fillers, the problem is not necessarily where the problem appears to be, but you have to make the whole area better. And with Secret, we need to tighten up the whole thigh. But we've had spectacular results with the knees.
How about Manu? Anything you've been really kind of surprised or really delighted with since you brought Secret RF into your practice?
Dr. Manu Agrawal is a board-certified and aesthetic laser-certified family physician specializing in vein disease. She founded the Vein Care Center Laser Specialist in Lima, Ohio, and is also an associate professor at Athens College.
Yes, for me, it's been a lot of the dyschromia that you get, the red-brown discoloration with the skin due to sun damage. Even patients with mild telangiectasias on their face, I typically would say, we're going to use my XLV and we're going to get rid of these telangiectasias first. But what I've found is with the Secret RF, I don't necessarily need to treat their telangiectasias or even some of their pigmentation because their skin is so much brighter and their discoloration is practically gone. I may need to use maybe one laser treatment to kind of do a little bit of cleanup, but it's really that brightness to the skin. I had my treatment done one treatment done about 5 weeks ago, and I think my husband raved about my skin for about 2 weeks, so that was kind of a plus. So it was, that part's been really interesting and really quite a nice surprise.
That's spectacular, and that's really been my experience as well. I've gone after patients that have had this really thin, kind of crepey skin, knowing that I wanted to help thicken that skin up and improve the tone and texture of it, and actually thinking that I'd have to go back and use the XLV to get rid of their telangiectasias. And I too have noticed that it actually does take care of some of these fine telangiectasias, and I think that is kind of that micro cautery effect that you get, and it's probably a function of some collagen building too that helps mask those little fine telangiectasias. Excellent point. Jeff, any other thoughts on kind of how this has really changed our practice?
Well, I think one thing I've noticed, Ashish, is that this has really grown and expanded our patient demographic. I think we're able to capture both older and younger patients. Older patients because now we can non-surgically and dramatically improve the eyelid drooping and hooding and laxity and neck skin issues. And then we can, on the other end of the spectrum, we're getting more younger patients because now there's so much shorter recovery time compared to lasers. So now younger working men and women can enjoy a great outcome and still go to work and still maintain their activity. So I think from that perspective, that's really expanded our practice quite a bit from just adding this one device.
Yeah, I do believe that was really kind of unexpected, right? Because I think when I was thinking about this, I was thinking about really being a lesional type treatment, but it really is kind of more of a global rejuvenation treatment that has very little downtime, but we can customize it to be very aggressive for acne scars and whatnot.
This panel discussion has provided some important insights into the potential benefits of Secret RF in aesthetic practices. As Dr. Su notes,
we've gone through how this device is decreased the downtime. We have increased the efficacy. This is versatile for just about anybody that walks in clinic, and we're treating a variety of conditions, including pan-facial rejuvenation, eyelids, neck, stretch marks, scars, even the arms and knees. Anybody else have any final pointers and pearls for us?
I have one comment that I neglected to mention earlier, is that I've had really nice results on treating the jowls, the area under the neck, and the bra fat area by driving the energy down to a deeper level.
If there's no other comments, let's go ahead and wrap up. Thank you again to Tara for putting all this together. It was very informative for me because I got to learn from really the national experts on the secret RF. So I want to appreciate Tara for this opportunity. Ashish, any comments?
I just want to say this has been extremely enlightening because this is a new device to the market, and putting it in the hands of experts like we have on the call here today, we've really been able to learn a lot about how this is used in practice and really how to optimize our treatments to give our patients the best results. So I want to just thank everybody for participating today and for your time and for helping educate us in moving this technology forward.
To learn more about secret RF and how it may fit in your practice, visit Cutera.com.